Alrighty, hi, my name is Sunny. I'll be your student nurse today, and I have to do a head-to-toe assessment on you. So it's going to be some touch, some range of motion. So if you're okay with that, then I'm going to go ahead and proceed with my general assessment. I'm going to perform hand hygiene and then ensure patient privacy, and I'm going to verify that first. So tell me your first, last name, and date of birth.
Ryan Bruns, January 15th, 1994.
Okay, perfect. So upon entering the room, I have noticed that the patient is sitting erect. He's sitting straight up. His affect is positive, and there's no abnormalities, so no amputees, no prosthetics or anything like that. So if you don't mind me asking a couple questions, I'm going to ask where we're at.
The hospital.
Okay, perfect. And then can you tell me what year it is?
2021.
Perfect. And also, can you tell me the president?
Joe Biden.
Perfect. Awesome. So the patient is alert and oriented times 4. So I'm going to go ahead and move on to your head assessment, okay? So as well as, so the patient is coherent, and my table, not operation table, is at a good height for me. So he's safe. That's perfect. I would use gloves to go through the hair, but I only have one set of gloves, so I'm just going to use the gloves for the mouth for sure. So I'm going to inspect the hair and the head. So the patient's body is proportionate to his lifestyle, and he's not overweight, not super underweight. He's proportionate. So if you don't mind me, I'm just going to go through your hair, okay, and feel your head. So the head is proportionate, or is symmetrical and proportionate to the patient's body, and the hair is thick, clean, as well as the patient is overall clean. There's no odoriferous smells, there's no lesions, and the scalp is warm and dry. I'm going to go around your ear. I'm going to feel behind here. Is there any tenderness upon me feeling your head?
No.
No? Okay, great. So there's no parasites, there's no lesions. And the scalp is round. There's no divots or masses. So that's great. Perfect. And then I'm going to go ahead and go to your face, okay? So I'm going to inspect the eyes. So I'm going to pull down your lower lid, okay?
Okay.
And that's called the conjunctiva. And the conjunctiva is pink and moist. And the sclera is white and moist and shiny. There's no lesions. And then the pupils, they're about a 4, and they're equal. And then I'm gonna test this with my light, okay, to make sure that they constrict equally. So I'm just gonna do this. And the pupils, they did constrict equally. So now I'm gonna go to the other side and do the same on this side. Perfect. And they both did constrict, so they are equal. And then basically, I'm gonna go ahead. What? Not yet. And then I'm going to do a motion, so just follow with the tip of my pen light, okay? Try not to move your head too much.
Okay.
This. Good job. Awesome job. So they do move equally. You're good. You don't have to follow it anymore. The muscles are intact. They move equally, so everything checks out on your eyes. So now I'm going to go ahead and go to your nose. I'm going to palpate the nose, and then I'll look up inside your nose too. Make sure there's no tenderness. There's no masses, sorry. And then the septum is intact. There's no deviations. I'll have you go ahead and check the patency. I'll have you go ahead and close one nostril. Breathe in and out. Okay, so patency on that nair. Do the same with the other side. Okay, patency, awesome. And then go ahead and tilt your head back just a little bit for me. So the nose, the color of the nose does match the patient's ethnicity, so it is appropriate, and it is smooth, there's no masses. And then upon looking up inside the nares, there's no masses, no bleeding, no discharge, no mucus. It does look clear, so that everything checks out. Okay, you can go ahead and put your head down for me. Alrighty, and then I'm gonna go ahead and go to the ears, okay, and then I'll go back to your mouth. So I'm gonna check the ears. So the patient's ears are pink, warm, and dry. They are elastic. Is there any tenderness behind your ears? Okay. And there's no discharge coming out of the ears. They are symmetrical and equal and proportionate to the patient's head and to the eyes. So I'm gonna go ahead and look inside of your ear, okay?
Okay.
So there's no polyps, no mucus, no lesions, no blood on the side. I'm gonna go to this side. Alrighty, so this one is as well pink as well. There's no masses, lesions, blood, or mucus draining out of there. So everything checks out in your ears. I'm gonna go ahead and have you do a hearing test. So I'm gonna have you close this ear first,
Okay.
and then just make sure that you can hear what I'm doing. It's just like a hair rolling.
Okay.
Do you
Yep.
hear that? Okay, perfect. And then close that ear.
Yep.
Awesome. So everything checks out. I am gonna go ahead and go to your mouth. I'm gonna put on gloves for this part. So just a second here. Are you doing okay so far?
Yes.
Good. Do you have any questions?
No.
No? Okay. So upon looking, the lips are pink and moist. There's no cracks. They're not extra dry. I'm going to go ahead and take a look inside of your mouth. Can you stick your tongue out for me? Perfect. And then can you puff your cheeks? Awesome. Can you smile? Can you frown? Okay, so the face is symmetrical. There's no drooping. And as well as the eyes, there's no nystagmus. Okay, so go ahead and open for me. I'm going to check the inside of your lips. So it is moist, pink. There's no lesions on the buccal mucosa, as well as the lingual. The gums are very healthy. The patient has good overall oral hygiene. And like I said, the tongue is symmetrical. The tongue is pink, as well as it has ridges on it as it should. And then go ahead and tilt your head up. I need to look at the palate. Awesome, perfect. So the palate is pink and rigid. And then I'm gonna go ahead and look at the uvula. Okay, so say ah. Okay, perfect. So the uvula is midline and mobile. The oropharynx, is pink, as well as the tonsils. There's no lesions or pus. So overall, everything in the mouth checks out. There's no abnormalities. There's no cavities. Like I said, the patient has good oral hygiene. So that looks good. Awesome job. Thank you. So I'm going to perform hand hygiene, and then I'm going to move down to the neck. Awesome. You're doing really good. Okay, so I'm inspecting the neck. The neck is appropriate for the patient's ethnicity. There's no lesions. It's warm, smooth, and dry. And the trachea is midline. I'm going to touch your trachea, okay?
Okay.
So there's no masses. There's nothing sticking out. Like I said, it is midline. Alrighty, so now I'm going to, palpate the sinuses, so the maxilla and the frontal. Not to jump around, sorry. Okay, so now I'm back to the neck.
Head motion.
And then do the head motion. Do this. Tilt your head back. Do the ear to the shoulder. Same on this side. Do your chin to your shoulder. Perfect. And then I'm going to check your muscle strength. So lift up against me. Awesome. And then can you just rotate your shoulders for me? Perfect. So range of motion is full range. And then I'm gonna go ahead and palpate the lymph nodes. So the preauricular, the postauricular, the occipital. Do you feel any tenderness?
No.
No? The submandibular. Okay, sit still. The submental, great. And then the cervical. So I'm just gonna palpate, make sure nothing's sticking out, as long as there's no tenderness. And then the supraclavicular, no tenderness,
No.
Awesome. So now I'm gonna go ahead and feel the carotid. I'm gonna do one at a time. So the carotid is 2+ strong. 2+ and strong. Awesome. So I'm gonna take a listen to your carotid, okay, to make sure there's no brewery. So that's basically hearing if there's any blowing. Okay. So if you'll just take a deep breath in and then out and then hold it for me. Okay, no brewery noted. You can go ahead and relax. I'm going to do the same thing on the other side, okay? Okay, no brewery noted, so that's great. I'm going to go ahead and go to the upper extremities, so the arms. So I'm inspecting the skin color. It's warm, smooth, and dry. There's no lesions, no masses. Everything looks good. And the skin color matches the ethnicity of the patient, so it's appropriate. I'm going to look at the nails. They are pink, well kept and trim. And then I'm going to do capillary refill. Okay, so it's definitely, it's under 2 even. So go ahead and move your finger joints for me. Make sure the motion is in full range. Move your wrist for me as much as you can. Perfect. So there's no clicking noted in the wrist. I'm going to go ahead and have you do that bilaterally. There's no crepitus. Go ahead and do that. There's no crepitus. Okay, and then go ahead and do this for me. Just flags, yep. And then hyperextend. Perfect. Do the same on that arm. So full range of motion. The patient's joints, there's no clicking, and they do have full range of motion. So now I'm going to go ahead and palpate the radial bilaterally. Okay, perfect. So I did find them, and they are 2+ strong, equal bilaterally, and I'm going to do the brachial. Okay, perfect. So they are 2+ strong and equal bilaterally. So everything checks out on your arms. Awesome. So I'm going to have you go ahead and switch over to that because I'm going to check out your back, okay? I'm going to do lung sounds and everything like that. So I'm just having him move for the purpose of the video. That way I can get this on camera. You can go ahead and pull your shorts up for me. Awesome. So I'm going to inspect the back. I'm going to make sure that the spine is midline. There's no deviations, no tenderness. Do you feel any tenderness?
No.
No? Okay, awesome. You guys can see that. He states that there's no tenderness. And then I'm going to go ahead and check for CVA, okay? So I'm going to put my hand below your ribs. And then you're going to feel a pound, okay? I'm going to do that twice and tell me if there's any tenderness. Any tenderness?
No.
Perfect. Any tenderness?
No.
No? Okay, perfect. So the patient's skin is warm, smooth, and dry. There's no lesions. There's no masses. It is appropriate for the patient's ethnicity. So I'm going to go ahead and listen. I'm going to auscultate the lung sounds, the posterior thorax. So upon this, I'm gonna move my stethoscope, and each time I pick it up and put it down, go ahead and take a deep breath in and out for me, okay?
Okay.
Awesome. So go ahead. Perfect. Go ahead. Awesome. Good job. Good job. Sit straight up for me. Perfect. Couple more times. Awesome. Little touch here. Okay, same thing on this other side. Awesome. So you can pull your shirt down. So the patient's lungs are clear. So now you can go ahead and switch back to over here. Thank you so much. Sorry about all the moving. But anyway, so I'm gonna go ahead and inspect the chest and then listen to your lungs one more time, and then we'll do your heart, okay? So lift your shirt up for me again. Perfect, thank you. So upon inspection, the patient has chest hair, stomach hair, and it is not abnormal. So it is abnormal for a male patient. The skin is warm and dry. It's smooth as well, and it is appropriate for the patient's ethnicity. So I'm gonna go ahead and listen to your lungs, okay?
Okay.
Is your day going okay?
Yes.
Good. Alrighty, so I'm gonna have access way up here, okay? And then I'll move my way down. Same thing with the back side. Breathe in, breathe out.
Okay.
Good job. Good job. Perfect. Good job. Thank you. Last one. Perfect. Awesome. So now I'm going to go ahead and listen to your heart, okay?
Okay.
So we have to do the heart twice pretty much, because the second time around I have to listen for any brewery, okay?
Okay.
So I'm going to listen to the aortic, which S2 is the loudest. Perfect. Pulmonic, S2 is loudest as well. Awesome. Herbs, this is just a midway point. Okay. And then the tricuspid, so this is where S1. Awesome. And then the mitral, or the apex, and this is also S1. And then I'm going to go ahead and count your heartbeat for a full minute, okay?
Okay.
You can breathe, you're good. Okay, I'm going to start at the 30. Press the button for me. Perfect. Perfect. So the patient's heart rate was 81, and it is within normal range. So the heart rate is supposed to be from 60 to 100. So it is within the normal range. And the patient's respirations, they are equal. They're unlabored. So perfect. You can go ahead and put that down. Do you have any questions so far?
No.
No? Okay, perfect. You're doing really good.
Okay.
So actually I'm going to have you I have to do the bell side. Sorry. I'll have you lift your shirt up one more time. I have to listen for any brewery. Okay. Let me switch this. So, okay. Aortic. Pulmonic. Herbs. Tricuspid. Mitral or apex, and there's no brewery or swishing, so that's good. I am gonna have you go ahead and lay back for me.
Okay.
So just put your legs that way and I'll assist you. Perfect. Awesome. So I'm gonna have you lift up your shirt one more time, and then I'm gonna go ahead and inspect the abdomen. So the patient has scaphoid, so the stomach kind of goes in. And I do see an aortic pulsation, so I'll listen to all the valves, in the stomach, and then upon inspection, so the patient's stomach is warm, it's smooth, and it's dry, and it is appropriate for the patient's ethnicity. So I'm going to go ahead and listen to your stomach, okay?
Okay.
Do you have any issues with urination?
No.
Upon streaming? Okay. So since he doesn't have any history of urination, I'm not going to check the suprapubic area. I will still palpate, but I'm not going to deep palpate that area. So I'm checking the right lower quadrant for gut sounds. Perfect. So the right upper quadrant, gut sounds. Perfect. The left upper quadrant for gut sounds. And they're every 3 to 5 seconds, so they're normal active, they're not hyperactive or hypoactive. So the left lower quadrant is the same. So that's perfect. I'm going to go ahead and switch my stethoscope around. I'm going to listen to the aortic valve for any brewery. Okay, and then the renal arteries, so the aortic artery and then the renal. And then the iliac artery. And there's no brewery noted. Perfect, awesome. So now I'm gonna go ahead and palpate. I'm gonna palpate your stomach to make sure that there's no tenderness. If there is anything that hurts, just let me know, okay?
Okay.
Perfect. Alrighty. So upon doing this, I'm checking for masses. So I'm just doing light palpation. So perfect. Everything checks out. There's no masses. So I'm going to go a little bit deeper this time, okay?
Okay.
Perfect. You're doing really good. There's no masses noted in the stomach area in all 4 quadrants. So now I'm going to go ahead and move to your lower extremity, okay?
Okay.
So you can go ahead and put your shirt back down. So I'm going to make sure that your hips are okay. Going to feel for any masses. Perfect. Or edema. There's no edema noted, so there's no swelling or anything that sticks out to me. Perfect. So I'm going to inspect the toenails. They are pink and they're well kept and trim. And then I'm going to do capillary refill. Perfect. So it's less than 3 seconds. Go ahead and wiggle your toes for me. Make sure those joints have full range. So that's perfect. I'm going to go ahead and push up against your feet. Push towards me.
Okay.
This. Push towards me. Awesome. So muscle strength is intact for the feet. Go ahead and push up on your legs for me. Awesome. So muscle strength is good in his legs. So I'm going to go ahead and do full range of motion, okay? And upon inspecting his legs and feet, there is hair growth. It's normal hair growth. It's evenly distributed. And then I'm just going to palpate the popliteal and the popliteal pulse equally, okay? Bilaterally. Perfect. So they are 2+ equal. They're strong. Then I'm gonna do the posterior tibialis, which is near the ankle, which was easy to find. That's great. His is strong, 2+ equal. And then I'm gonna do the top of the foot, the dorsalis pedis. Awesome. So they are 2+ equal bilaterally. His veins are really good. So I'm gonna go ahead and do range of motion on you with your legs, okay?
Okay.
So we're gonna do one leg at a time.
Okay.
So I'll have you flex your leg, push your knee, perfect. And I'll have you go eversion, inversion. So I'm checking your hips too, so do it one more time for me. Eversion, inversion, perfect. So there's no clicking in his joints on this leg. Can you move your leg out for me? So adduction, adduction, abduction, adduction. I'm gonna go to the other leg, do the same thing. So I'll have you flex this leg for me. Perfect. And I'll have you go inversion, eversion, and there's no clicking in his joints. And he does have full range of motion, so everything checks out there. Perfect. What else? What? Yep, I already did that. So you can go ahead and sit up, and then I need to assess your gait for me, okay? So just walk to the camera.
Okay.
So the gait is stable and equal. I'll have you sit back up here for me. I need to do one more thing on your hands. I need you to squeeze my hands.
Okay.
Okay? And then I'm gonna push, and then push against me.
Okay.
Perfect. So his muscle strength is intact overall. Do you have any questions? Everything checks out really good.
Yeah.
All right, perfect. Thank you. And that concludes my head to toe assessment. If we were in a hospital setting and he was like inpatient, I would make sure that the bed was lowered down, that he was comfortable, the call light is in reach, and that his personal belongings are near. I'm going to perform hand hygiene and then document. So, thank you.